Welcome. Welcome to HIP, Health Insurance Personalized. This is Consumers Doctor on the behalf of foremost organizations and catastrophic category. You need to have four categories. They need to be segmented. Your premiums need to be based on the risk. I can't be more emphatic than that. You have to have a consumer and they have to be categorized into four risks. Everyone have to be grouped with a similar health risk, either good or bad, but they have to be grouped in a similar risk. What is the next big idea? So-called health insurance consumerism, consumers, so-called healthcare consumerism. Efficient free market always respond to consumer demands for products, services, and information, folks. Products, services, and information. It is time we tried consumer-driven, patient-centric system, folks. That's what we need. Consumer-driven, patient-centric system. What is the next big idea? Let's have a personalized health insurance, folks, for every American, irrespective of the socioeconomic status. Personalized health insurance is a voluntary, hassle-free idea that focuses on importance of health insurance affordability and choice. It does not mandate any plan design. With personalized health insurance, premiums will be 15 to 20% lower, folks. 15 to 20% lower. I'm not kidding. They will be 15 to 20% lower. What is the next big idea? You may ask, is individual health insurance. Individual health insurance. Affordable individual health insurance should be guaranteed issue, covering pre-existing conditions and help the sickest among us with the most serious impaired health conditions, folks. Irrespective of the economic status, irrespective of the race, irrespective of the gender, irrespective of, right now, the way I see it, insurance premiums may not be based on the gender at all. It has to, irrespective of the gender, irrespective of anything, irrespective of any class, any like a gold plan, platinum plan, bronze plan. We don't need to have a class system, folks. We don't need to have, irrespective of their economic. Everybody should have individual health insurance. It is a must. Everybody should have individual health insurance. What is the next big idea? The idea is smaller health insurance, smaller group health insurance. This is the backbone of our country, folks. Small businesses, this allow segmentation of small groups into impaired health support plans on application and first renewal. This will lower smaller group health premiums by 15 to 20%, folks. 15 to 20%. Small group health insurance, and they should be able to pool together and they should be able to have the same premium based as when you compare with a larger employer group. So let's have a segmentation of a small group members into impaired health support plans on application and renewal. What is the next big idea, folks? you may ask? Large self-insured groups, so-called large employers, need a healthcare reform more than health insurance reform, folks. They need healthcare reform. Large insurance self-insured groups would benefit from transparency of medical service costs, medical quality standards, and also taught reform to minimize the excess costs of defensive medicine. It will benefit the providers by doing so. The insurance, larger self-insured groups require more of a health care reform, which is more transparent, and they should be able to access to their personal care accounts like health reimbursement accounts, health savings accounts. These are the personal care accounts, and we need to have a tort reform to cut down the practice of defensive medicine by all providers across the spectrum, all providers, because most of these healthcare facilities, most of the healthcare professionals are practicing defensive medicine, and it costs. When you have phenomenal awards, when your awards are so high, they had to protect themselves from these unnecessary claims. So we need to have a tort reform, folks. What is the next big idea? Is appointing a health review authority which doesn't cost the government a penny. It doesn't cost the government. It is a public-private partnership, folks. Even most of the Democrats embrace the public-private partnership to avoid fair segmentation of risks and the empowerment of consumers who were rejected for health insurance, or they are so-called uninsurable. Health Review Authority guarantees who are uninsurable, were originally rejected, they protect the consumers who need the most. Health Review Authority is like a monitoring agency for the insurers and the customers. So it's a enforcing authority. So we need to have a public-private partnership. So it will not cost the government a penny. What is the next big idea? You may ask. Access to care. Access to care. We need, with the technology we have, with the telemedicine, telehealth, and hubs, so-called hubs, satellite hubs, we should be able to provide the access to care, the best access to care, and mobile technology has literally changed the trend of access to care. You should be able to access your healthcare professional through your mobile phone. It is, and also you can access nurse practitioner and personal care assistants, physician assistants through a mobile technology. And for those services, they need to be reimbursed as soon as they receive the care. So it's very important. Access to care has to be the best. We want to be the number one. Consumers are the only one will demand for the best care, like we have seen in other sectors of our industry. And quality. Consumers demand quality, folks. Consumers are, you one size fits all from top down will not give the best quality of care. As long as the consumers are in the driver's seat, you will, they will, consumers will demand quality of care. So there is no other option, folks. We have to provide the best quality of care. That is the next big idea. What is the other big idea? Cost of the care. Cost of the care. It is, unless we are transparent in our healthcare cost, the costs can be lowered with segmentation, especially for the insurance premium, can be lowered with segmentation by the health status or risk. These group impacts and personal impacts to costs. So group and personal changes in behavior can lower the use of medical services, lower the costs of care, reduced premiums, and offset out of pocket costs. Yes, it does offset the out of pocket costs. What is the next big idea is financing the health insurance. How do you? It is not the financing the health insurance. There are several ways to finance it. We used to depend only on one, but now we have other options in addition to the insurance. In addition to financing through the insurance, we also have savings, taxable, non taxable, HSAs and HRAs, and you can have incentives and rewards to the consumer who follow. So there are three aspects to the financing. One is the insurance premium. Number two, it is a savings, taxable and non-taxable, and incentives and rewards to the consumers. If they are personally responsible, we should be rewarding the consumers, folks. We should be rewarding. That will lower the cost of the overall cost of the care. What is the next big idea? Individual certificate of guaranteed coverage, folks. Individual certificate of guaranteed coverage empowers and guarantees every individual health insurance, even if they have a pre-existing conditions or in need of a financial assistance. Segmenting, segmenting uninsured individuals to the premium subsidized impaired health support plans can lower the premiums by 15 to 20%, folks. 15 to so individual certificate of guaranteed coverage, irrespective of economic or physical status. Health Review Authority will enforce that rule of covering the individual certificate of guarantee. And smaller group, what is the next big idea? Small group certificate of guaranteed coverage. That's a big idea, folks. Smaller groups, small businesses using the certificate of guaranteed for small groups along with the impaired health segmentation application and first renewal can lower the small group premiums by 15 to 20%, folks. 15 to 20%, yes. What is the next big idea? Is, as I mentioned earlier, impaired health support plans. We have to have impaired health support plans. Enactment for these plans will provide maximum help and support to those most in need. This will be monitored by the Health Review Authority, and every beneficial service and assistance and plan design options will be available to those with chronic and persistent illness. These are the people who need the most focus on impaired health support groups and plans. What is the next big area? Eligibility for the impaired health support plans. Eligibility. Providing the eligibility to both uninsured individuals and small group members will provide the targeted support, choice of plan options, and affordable health insurance for the sickest among us, folks, for the sickest among us. What is the next big idea? Options for impaired health support plans. What are those options? Provide those in need of impaired health support plans with insurance plan options related to their unique needs. You need to have insurance support plans for everybody's unique needs. What is the next big idea? The participating insurance companies, participating insurers who voluntarily participate with the health review authority and accepts certificate of guaranteed coverage will have a biggest market share and pricing advantages for both individuals and small group policies. Individuals and small group policies. What is the other big idea? Cost of being voluntarily uninsured. There is a cost to it, folks. We have 27 million uninsured. There is a cost for people who don't buy the insurance. We are losing federal and state personal tax. The people who don't buy the insurance, they lose the deductions that the revenue what we collect from these folks, people who don't buy the insurance, they lose the deductions. As a result, state and federal government will be able to collect more revenue. That should finance the impaired health support plans, folks. That's how we get the funding. People who don't buy the insurance, they lose the deductions. As a result, we're collecting more revenue onto the state and federal agencies that should support the impaired health support plans. What is the next big idea? Funding the health review authority and impaired health support plans. Funding. How does the funding happen? Health review authority should operate self-sufficient entity deriving operating funds. This is very important. Operating funds through multiple membership and processing fee. This should not strain on the state and federal governments. This health review authority should be able to fund itself by multiple membership and processing fee. The impaired health support plans claim to be supported by commissions, tax deduction, and tax deduction losses, charity donations, coupled with state and federal subsidies, folks. This is what it is. This is what we need to look at how we can improve the healthcare by with those big ideas what I talked about. I think it makes sense for the consumers to be in the driver's seat, folks. Health insurance affordability, knowing the truths about health insurance reform. Basically, we really need real changes to the health insurance and also to the health care. That's how we can make the consumers, we as consumers have to demand affordability, demand transparency, demand competition, demand competition. I think this is how we lower the costs of the healthcare, folks. Thank you for listening. Subscribe, share, and make some comment, folks. I'd love to hear from you. Thank you for listening, and we will see you in the next episode. Salute. talk about big ideas. What are the big ideas in healthcare? One of them is Medicare for all, but let's look into it, all the aspects of Medicare for all. The big ideas, what we our main goal is to see if consumers could be in the driver's seat. That's the ultimate goal, where consumers are the only one is a powerful force to lower the cost of the healthcare, folks. Ultimately, consumer is the one which lowers the cost and no one else, including the government. Even if you have one size fits all approach, unless the consumers are in the front line, there's no way we can lower the cost. And the risk segmentation, folks. So as a consumer, you have a right to be grouped with others with similar health risks, good or bad. It doesn't matter, good or bad. Only then you'll be able to get relevant and timely information and appropriate level of coverage and proper medical care at an affordable insurance premium. Consumer demands affordable insurance premium. The risk segmentation is so critical into a well category, at risk category, chronic illness category. How do we achieve it? What are those big ideas? Number one, I mentioned to you about risk segmentation. Right now, the health insurance companies are not segmenting. They're not based on the risk segmentation. Your premium is not based